Y'all, I'm coming. I got to get my light to work. Y'all, come on in here. Come on in here. Come on in here. I'm coming. I just realized it won't on. I'm coming. Come on in here, y'all. Come on in here. Come on in the room. Come on in the room. Y'all, come on in here. Come on in here. Come on in here. I'm coming. Come on in here. Come on. Come on. Come on in here, y'all. Come on in here. Let's get it. Let's get it. I'm trying to get my sign to work, y'all. Come on in here. Y'all give me about 2 more minutes. If it don't come on after this, I'm going to get started. Come on in here. Come on in here, y'all. Come on in here. Yes, come on in here. There we go. Come on in here, y'all. Come on in the room. Come on in the room. Come on in the room. Let me get my drink right here. Come on in the room, y'all. Come on. Y'all come on in here with your queen. Come on, come on, come on, come on. Yes. We got a very serious topic I'm going to talk about as usual. Y'all know me. Y'all know me. I'm going to bring it to you. I'm going to bring it to you. I most certainly am. Ooh, excuse me, y'all. Come on in here. How's everybody doing today? Let's set this right here. How's everybody doing today? Is it cool where y'all at? Is it cool where y'all at? It's cool where I'm at. I don't know about y'all, but it's sort of cool. I had to turn my heat on the other day. I was trying not to, but I could tell the kitty cats was getting cold. Hey, Janet. Hey, my love. Thank you for being in here. Thank you so much for being in here, my love. Thank you. That food looked so good you did the other night on TikTok, girl. I tell you. It looked so good. Oh, my gosh. It looked good. It looked so good, y'all. Y'all go visit Janet, Diva, is it Diva 62? Janet Diva 61 on TikTok. Let me know. Put it in the chat. Let me know. So I want to call it out right. I won't be saying nothing wrong. Let me know. Y'all go follow Janet. Janet Brown. That's my ex co-host. She was my co-host for years. And she went on to her own endeavor. But yeah, she's on TikTok. She's cooking vegan meals, all of that. When I tell you they be looking good, she also does on her Facebook page. Jan's in her kitchen, in her own kitchen. Y'all, I'm sorry. Y'all hear that noise? That's the keyboard. That's what y'all hear. I'm sorry about that. I am so sorry. I am so sorry. Yes. Y'all give me a minute. Give me a minute. Okay. There we go. I'm about finished. One more thing to type. Okay. Gotta get my spelling right. There we go. Okay. Yeah, it's still cool here to me. That's why I got these long sleeves on. I don't have my heat on out here in my studio though. I don't. Nah, I won't gonna do that. But it's still kind of cool. Okay. So thank y'all. Give me a thumbs up if y'all can hear me. Those that's watching, the little red thingamajigam, you see the numbers going, you're watching me live. And thank you for tuning in to Miss J's Unfiltered Talk Show and Podcast. This is the platform and the talk show host that delivers. Okay. Did you catch that? That delivers. The topic I'm talking about tonight, I got 2 confirmations. That's why I knew it was time to talk about it. One of them, I'm going to show you a brief clip of a movie that I watched about a week or 2 weeks ago. So I started thinking then, but then this just haven't been too long happened to somebody that I know. That was when I knew then I had to talk about this. And the topic tonight is preeclampsia or eclampsia. I'm I'm good. Thank you. So it's Diva. Okay, so it's Diva Girl. So the follow Janet on TikTok is Diva Girl. I gotta get my glasses right, y'all. Diva Girl 61. That's her on TikTok. Y'all sprinkle this out, tap that screen, send them hearts all up, send them up, tap them stars, all of that. Cause Miss J gonna talk a little bit. I'm not gonna hold you long. I'm not. But anyway, I'm gonna dive. Y'all gonna see me looking down because my printer, I was out of paper. So usually I have my paper in my hand. I can sit it up. I got it on the computer. Okay. So you're gonna see me looking down. That's what I'm doing. With my notes here. So when we talk about have anybody if you've heard the term eclampsia or preeclampsia, y'all put your thumbs up, raise your hand, say I have, have you heard about it? Have you heard anything about it? And maybe say like if you knew somebody went through this, just throw your hands up. You know somebody that went through it, put your hands up, okay? So when we talk about eclampsia, y'all hold on, let me get this part out of the way. It's blocking my view. There we go. Hold on, y'all. This part, this other microphone part was blocking my computer right here. I couldn't see it. All right. So now I can. All right. So when we talk about pre-eclampsia or eclampsia. So what is that? I've heard of it. I've like I said, recently known somebody just went through this, and then the movie y'all saw. It's a very serious blood pressure condition. Okay, hold on. Let me see what Janet's saying. Janet's saying, I have. Okay, you have. Okay, you've known somebody. Okay, all right. It's a serious blood pressure condition that develops during your pregnancy, right? And it also can occur during postpartum. Did y'all know that? It can also occur during postpartum. It can also occur during postpartum. And it mainly affects the people that's pregnant that has high blood pressure, and it shows a lot of protein in their urine. If you're pregnant, now let me say this disclaimer: I am not a medical doctor, nothing of that nature. Everything that I'm giving on my platform is for educational and resources purposes only. I suggest to you, if any type of topic that I be dealing with, if somebody is experiencing that or have experienced that, please seek your medical professional. Okay, that's my disclaimer. I had to make sure to put that out there. Because I don't want nobody saying, oh, why she talking? No, I'm not no doctor, but y'all know I'm all about bringing information. Y'all already know that. I'm all about bringing information and bringing information to you. So, but again, if you're the type of person that had, and you're pregnant or was pregnant or you are pregnant and you keep coming up with a whole lot of protein in your urine, which is called proteinuria. Now, y'all know how I can mess some names up, but it's called proteinuria. Proteinuria. Y'all might know what I'm talking about, right? It's proteinuria, proteinuria. All right, that's not good. That is not good at all. That is not good at all to have in your urine. It's not. It's not good at all. Um, as I was doing my hold on, I see a comment. Janet is commenting because I try to get my comments sometimes. My daughter and my niece almost there we go. See, exactly. Thank you for sharing that, Janet. Thank you so much. Hey, Vegas. Hey, love. Hey, thank you for coming in here. It's very dangerous. It is very, very dangerous, y'all. Very dangerous. Um, but as I was doing my research, I didn't even know it was three types or three kinds, whichever way you want to use, three types or three kinds of eclampsia. Never knew it, but I did when I did my research 2 weeks ago. That's when I, digging this stuff fine. I'm like, okay, I didn't know that, didn't know, but here we go. Let me give you a little bit of information. The first type is the mild kind. So this form is characterized by a new onset of hypertension, high blood pressure, and protein in the urine. And this normally occurs after 20 weeks of your pregnancy, all right? And you may start seeing some signs of some mild swelling, okay? That's the mild form of eclampsia. Now it's better known as toxins, all right? Now we have the severe kind. Now, this is more serious form that develops with severe when you got real bad high blood pressure. And it normally going to be like 160 over 110 or higher on 2 occasions, at least 4 hours. And if you got that type of blood pressure within 4 hours apart, that's a problem. That's a problem, okay? And then that particular kind has a chance of has a tendency to start messing up some organs, all right? Causing dysfunction in your organs, which it includes renal, have kidney problems, and it might start messing with your liver some, and then might be start having a little fluid in your lungs. Okay, now the big kahuna is when it is actually full blown eclampsia. You got pre, and then you got eclampsia. This is the most severe form of preeclampsia, and is defined as the onset of unexplained generalized seizures in a woman without preeclampsia. Without preeclampsia. I'm going to say it again. Without preeclampsia. And it requires immediately attention regardless. It requires immediately delivery of your baby regardless what stage you're in. That's that dangerous kind right there. That's the dangerous kind right there. That requires, well, we got to take this baby. Whatever gestation, I guess that what I said, what period you may be in, that's the one that requires that baby got to come out. Because they don't want to lose you. They don't want to lose you and the baby. Got to do it. That's the bad one right there. That's that serious one. Eclamp. When you hear the word eclampsia, that's the bad one. Okay. So now let's look at when does it occur. And it could, like I stated, it could start about 20 weeks into your pregnancy. All right. About 20 weeks. So now, when we're talking about that, there's a lot of factors. I'm just gonna give you 2-3 of them. A lot of factors that pre-eclampsia. Let's look at a couple of key factors though. Number one, I keep telling you, I mentioned to you one time before, high blood pressure. High blood pressure readings of 140 over 90 or higher. Again, that protein in your urine, and that's called proteinuria, proteinuria. If I'm pronouncing it wrong, I'm sorry. I'm spelling it for you. Proteinuria. My nurses out here, so I might have come across it. Y'all don't hold against me, okay? So when that happens, when you have that a lot, that's an indication that it could be some kidney damage somewhere. As I stated before, my disclaimer, I am not no doctor, no nurse, no preacher, no teacher, none of that. But I everything that I'm talking about is all for information and educational purposes only, okay? I just want to bring information to help, educate my ladies, my people out here. So that's the one that we got some problems with here, okay? And then, like I said, if you got that protein in your urine, that's an indication you may have some kidney damage. So I'm pretty sure they're gonna look into that. So what I decided to do, I want to see, because y'all know I'm doing this. Though they know me, know I do this. Oh Lordy, Janet, you just said it right there. Because I'm gonna show y'all a video clip. Y'all seen me talk about, y'all let me talk about this real quick. Y'all seen me talk about this movie is what did it for me. And I know somebody just recently went through it, right? It's called breathe. When you just said the whole thing right there, Janet, doctors ignore it at times. Good Lord. Doctors ignores it at times. Hold that thought. Thank you, Janet, for that. It's because it's the truth. So what I decided to do, I said, okay, I want to see how does it affect a lot of black people, black women. Yeah, yeah. What is this the racial disparities of it? Anything I do, I'm always gonna look into the racial disparities or any type of information I bring because I'm gonna talk about it. I'm gonna talk about it. So preeclampsia and the black community. But y'all know black women has the highest risk of developing preeclampsia compared to any other ethnicity. Did y'all know that? Black women has the highest risk of developing that compared to any other ethnicity. And I'm gonna tell you a few things why. And it is very prevalent of being 60% higher. They have a 60% higher rate. Isn't that something, y'all? A 60% higher rate. Now, these are the factors. Some of our black women are disproportionately affected factors like lower income, limited access to health care, and inadequate prenatal care, which can contribute to the development and severity of preeclampsia. Did y'all hear what I just said? Don't have good access to good health care, and inadequate. They're not doing like they're supposed to. Inadequate prenatal care. Wow. Which can contribute to development or severity of preeclampsia. Black women may also receive less preeclampsia related blood testing. So when y'all my pregnant women out there, y'all listen. When you go to the doctor, y'all bring this up. Bring this up. Ask them about being tested, this blood test that they can take for preeclampsia. Okay. Yes, Jan, especially in the black community. Exactly. Can you bring my voice? You want to bring your voice on? Let me see how can I do that. Hold on. Now, Janet, you can come up and don't show your face. Just put your avatar on. You can. I want me to send you the link for that. Let me know, and now I inbox you the link to be able to come up, but don't show your face. Just have your avatar. Let me know. Let me know if you want me to do that. Okay. Let me know. So, black women may receive less preeclampsia related blood testing. Yes. And to less likely to be recommended. Most likely, the doctor going to recommend you this right here. Okay, hold on. Okay, Janet. Y'all hold on. I got a real Janet wanting to come up. Let me get her up here. Invite guests. Copy. Y'all hold on. I'm getting ready to inbox it to you, Janet. I just inboxed it to you. Check your messenger, not your text message, but your Facebook messenger. I just texted to you. I mean, inboxed it to you, love. As I was saying, black women may receive less preeclampsia blood related testing, and they are very recommended. This right here, aspirin. Now I'm gonna try to say this word: aspirin, prophylaxis, prophylaxis, aspirin prophylaxis. compared to other other women. The doctor's not going. They're not going to, more likely not going to recommend that for you, for us. Okay, that's bad. That's not good. But it's the truth. It's the truth. It's the truth. Let me tell you why I says the truth. Because I'm not going to tell her. No, when she read, I guess she'll come on and tell her story. But I asked her about that particular. Did your doctor ever tell you? Because when I do my research, hold on, y'all. Okay, Janet, you up? You up?
Oh, hello. How you
Hey,
doing?
love. Thank you for being up here, my love. You know I appreciate you. You already know that.
Man, I didn't even know that topic was coming up, but when you said that, that was just a green light. It was just
Yes, gotta
I
talk about
went
it.
through some serious traumatization for two different occasions. My daughter Princess, she almost died on the table.
Oh
Uh,
Jesus.
just neglect throughout her pregnancy of having preeclampsia, blood pressure like you was mentioning earlier skyrocketing with all the protein in the urine. And she kept going back to the doctor. The doctor was ignoring it, playing it off
See?
like it wasn't that big of a deal, saying that you're going to be fine. No, there's nothing wrong. And it was something wrong all that time until she became full bloom pregnancy. And it was just, she was suffering so bad, and we like to lost her on the table. Her blood
Hmm.
pressure went from being high during her pregnancy to stroke level.
Yes.
Yeah.
That's right. That's
And
right.
they were just prolonging it still to take the baby because all the fluid. They kept saying, oh, she's going to be fine. She needs to get no. And it kept on until her husband had to step up and say, get the baby out of my wife before she dies.
Exactly. Exactly.
It's so sad. In the black community, it is, that's where it's, basically, I don't know why that is. I guess due to some of the reasons that you gave earlier,
Hmm.
but but they neglect. I'm not racist or anything, but facts are facts. They
That's
ne-
right.
they neglect the black women in the health field, you know, producing their health, helping them along with their health.
Hmm.
We've been neglected in so many ways, but especially when they're pregnant and trying to bring babies into the world. I mean, just when I go to the doctor myself for certain situations, they tend to put off things, and tend to make
Yep. Yep.
excuses, and or trying to send you, like your PCP is send you to a specialist and things like that. I don't see the I want to ask a quick question, not off topic. What's the purpose of a PCP? You know, because they don't do anything.
Your personal care physician. Exactly.
Yeah, they don't do
Hmm.
anything
Hmm.
because that preeclampsia, it's been known to take lives.
Okay, I
You,
gotta cut. Thank you for coming in here. Keep it simple. Saint Ministry, and she said, as a 38-year-old medical professional, it is true. It yes. Thank you, my love, for your comment. And
yes,
thank
ma'am.
you, Janet.
38 years,
Thank you
she
for
know.
sharing that. I appreciate you sharing. No, I appreciate you coming here and sharing, Janet. You didn't have to do that. You see what I'm saying? I really appreciate that.
Okay.
And it's sad, but as I was get ready to say, the person that I know recently went through this. I asked that question about that aspirin, some, and she informed me not that nobody never even brought the word aspirin out of their mouth to her. That's when I said, yes, I got to talk about this. Is that
Wow.
that word that the doctor never recommended, and this is one of the factors what happened to us black women, why we're going through this, because that whatever that aspirin, whatever that is, aspirin, PROPHYLAXIS, obviously there must be something that will ward it off.
Oh no, that's asparagus. I can't hardly say that word. But
Aspirin pro
Asperger's.
something.
Asperger's. Is it
It's
Asperger's?
It's aspirin, ASPIRIN, and PROPHYLAXIS. And I meant to look what that up meant, y'all, before I came up here, but I forgot it. I did.
Oh,
That's
you know
when I
what
was
I'm.
going through my notes, I realized I said, gosh, I don't even I forgot to type in what that meant. What that's for. Um, but she never
Let me do the
never never
research
covered.
for you. I'll do it
Okay,
for you right
okay.
quick.
It's aspirin, ASPIRIN, PROH, PROPHYLAX.
My goodness, we ain't gonna never be able to spell that.
PROPHYLAXIS. Okay.
Yeah, I have to.
Janet's gonna get what that does. But whatever
Yeah,
it was,
I'm gonna attempt to do that.
she's gonna attempt to let us know what is the aspirin prohylaxis is for. But the person that I asked never heard. Nobody never brought it up to her.
Is it a medication?
It's a medication. Yes. It's
Okay,
blood testing and be less likely to be recommended aspirin pro whatever compared to other electricities. Y'all know I can't hardly talk good.
it's okay. Oh, this is trying to
Electricity.
connect with
Other
my.
women.
Oh no, it's trying to connect with my.
Okay.
Wait,
Other
hold on a
women.
minute. This
And
is.
she definitely told me she never done that. Nobody never mentioned that to aspirin nothing. Aspirin, as she's cause especially if something that was going to help her pull out of there or get out of there. Yeah, she would say yes. I want to try that. She said, but no, it was never mentioned to her about that. Okay,
I was trying to look it up
just to let y'all know,
on my
'cause I should.
iPad, but my iPad is connecting with you as well. It's just
Oh, it is.
yeah, it's
I'm looking it up now.
yeah. Just look that up.
Yeah, y'all just bear with me. I'm sorry, but I meant to have it already done. But That's the only thing I see that I didn't have right and ready for y'all. There it is right there. Okay. Okay, here it is. What it is. Aspirin pro prohylaxis, if I'm saying it wrong, forgive me,
That's okay.
refers to the use of low dose aspirin to prevent cardiovascular disease and other conditions. While low dose aspirin can reduce the risk of heart attacks and strokes in individuals at high risk. It is used primarily preventing the first heart attack or stroke. Yeah. So do you see why I said that? There, a lot of us don't get recommended that to prevent that
Wow.
stroke or that heart attack. That particular aspirin. Yep.
You know,
That's why.
that's good information.
That's why. Thank
When
you.
you when your segment is over, send me that so
Okay.
that I can send that to Soraya because they didn't offer that to her. She's a doctor out of Emory Hospital in Atlanta, and she was one that suffered from that as well.
Oh wow.
Yeah, she called me just she went into a renal failure.
Yep. You can do that. Go into renal failure. Yep.
Was shared with her
Mhm.
last baby that she had, and she must didn't know about it as well. Not all doctors are aware of these things. Obviously, all doctors are not aware of it.
Yes, exactly.
So,
Exactly.
so yeah, I'm gonna send that over to her so that she can become aware of it and help out
Mhm.
some of her patients.
Exactly. Thank you for
Wow,
doing that.
it was the reason why I tuned in today.
Yes, yes, and thank you. So now let's look at the causes and risk factors of this. When us ladies get this, does that cause actually the doctors really don't know what caused it, okay? But it's thought to be related to problems with the placenta not developing properly. So the
Hmm.
risk factors include if it's your first pregnancy, sometimes this how when people and see this person was their first pregnancy. This was their first pregnancy. Okay. And if you had a history of preeclampsia, you might have some issues again. I see your comment. Keep it simple. I'm gonna get to you, baby. And having chronic conditions like high blood pressure, diabetes, kidney disease, being over 40 years old or under 18. Mm. And certain autoimmune disease such as lupus. Okay.
Hmm.
Yeah, such as lupus. So let me read. Keep it simple. She says, let me just add, as a respiratory therapist over 38 years, I have found a lot of people of color, when I speak to them, they really don't convey or explain the reason they are calling as a clinician. My job is to get them to explain what the issue is. Might add as all the emotions cause. Usually they call based on emotions. Okay, being upset. Okay, yeah. So I have to ask open-end questions to find what's going on, to see what they have tried to see, have they tried to see what the issue is, so that we can come up with a treatment plan. This difference between me and a lot of others, not all, but others, is that I want to help them. I take the time to ask opening questions so we can figure out what's going on. And I stress the fact that you must help me. You first must help me. You must help me help you. Meaning whatever the prescription regimen is, you have to take it, and if there's a problem, you must report back to me. Other than that, we're going to assume that it's not working. Wow. 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 That's all right. I got you on that. Keeping it simple. I
That's
got
that's
you on
that's
that.
beautiful because
Yes.
there's
I'm gonna
not
get the
enough
other. I'm gonna get the
doctors like
other.
her.
Yes, that's right, Janet. That's right. So let's look at the symptoms. Here are a couple of symptoms. It was a lot, but I just got four down. It was about 10, but I got four down. Again, high blood pressure, protein in your urine, swelling in your face, feet, and hands, sudden weight gain. Wait a minute. No, I got five. I'm sorry. Sudden weight gain, severe headaches that won't go away, and
Hmm.
vision changes.
Yep.
Wow.
My baby had all them.
Wow. Wow.
Walking in this heated
Shortness of
sun.
breath and shortness of breath.
Hmm.
Wow. Isn't it something?
It's so sad. It just
High
almost
blood
want to
pressure,
cry.
protein
It's
in the
just
urine,
sad.
swelling in the face, feet, and hands, sudden weight gain, shortness of breath, vision changes, severe headaches that just will not go away, and protein in your urine. Wow. Those are symptoms, y'all. Those are symptoms, my ladies. If y'all got somebody that's expecting their first baby, second baby, whatever, start talking to them. Start talking to them and keep
But
it
you have to
simple.
do like the young lady just said. You have to invest in your own health.
Exactly.
You know,
Exactly.
you have to do
Mm-hmm.
that. You have to invest in your own health by knowing your body,
That part.
knowing that there's something wrong and getting a second opinion. If that doctor or that physician is not taking care of your needs, seek someone
Mm-hmm.
else.
Mm-hmm.
You
That
just
part.
have to. I was telling my daughter, she said, "Well, he's the one that's been following me my whole pregnancy." Oh, well, he's not listening.
Exactly. That
You know,
part.
but he's been a doctor for so many years. He was real old, so she trusted him.
Mm-hmm. That's where it usually be. That's the sad part. That's the way that family doctor, that's we just trust what they're saying, but you gotta also trust your body.
Yeah, you gotta do what's right for you because I hate to say it, the medical field is just like police officers. All
Mm-hmm.
police officers are not great, but then there's some that care. All doctors are not great, but then there's some that care. You have to know who has your best interest at heart.
Exactly. Exactly. So what I'm gonna do real quick, I'm gonna start right here. Next part is gonna be about complications. But I'm gonna show y'all this clip of this movie that I was telling y'all about. The movie called Breathe.
Mm, he gonna be here at 4:30. It's
Huh?
4:17. He picking you up at 4:30.
Oh, I
I'm
thought
sorry.
you were talking to me. I'm sorry.
I'm sorry.
Oh, that's okay. Hold on. I'm trying to get it so y'all can Okay. Let me go to it and start it.
I mean, I gained 15 pounds in a week. I'm clearly swollen. I'm sore. Look at my leg. What is that? I don't know, it just popped up this morning. I can't breathe at all. And I can't even lie flat.
Well, how do you sleep?
Like this.
That can't be healthy.
No, it's not. I feel bad for Sam because I'm sure he thinks I'm crazy, but I'm not. Something is wrong. I just don't feel good.
Well, you need to go back to the doctor and you need to tell him everything. You need to tell him about the swelling, the weight gain, especially this bruise. I mean, all of it.
15 pounds.
But listen, nobody knows your body better than you, so you need to listen to your body. And if you still don't like what he's saying, then you need to find another doctor.
Tell me about it. Because Dr. Whitworth ain't
Oh,
worth.
be nice.
I'm trying. Can you help me with this pillow? Push it up.
I mean,
Push it, push it, push it. Push it
okay,
up.
stay up.
Okay. Okay, push higher.
You have to relax. Stay up. Stay up. Thank you. There. That better?
I'm glad you're here.
You trying to make me mad that I'm here, but it's gonna be okay.
I'm sore.
Oh,
I'm feeling good.
I'm gonna find your husband. I can't deal with this. Sam!
It's the worst.
Okay, pay attention. Y'all pay attention. Pay attention.
Mrs. Logan, your blood pressure is extremely elevated. That with the swelling in your legs, I think that we should admit you. Now, did your doctor happen to mention anything about inducing labor just to relieve some of the pressure?
No.
Do you mind if I call him?
Please.
Okay, excuse me. Dr. Whitworth, hi. I happen to be with one of your patients, Angela Logan. I'm very concerned about her. She has extreme swelling in her legs. Yes. I'm almost positive she has edema. And she's hypertensive. I think that you should come by immediately. I think that she should be admitted. No, Dr. Whitworth, if you just listen to me for 1 second, just listen. I mean, I'm here with her right now. The cracking in her legs. I'm looking at her legs right now, Dr. Whitworth. Yes. Yes. I understand. Bye. Your doctor seems to think that you're fine. And unfortunately, his opinion takes precedence over mine.
Something is wrong. Something is very, very wrong, and someone has to do something about it. Please.
Okay. What I can do is I can order some tests and get the results back immediately. I can do that, okay? And I can have them back to him by the time he's finished with his examination. Okay? Either way, we'll get to the bottom of it.
Once again, you're worried about nothing. What you're feeling is normal. This is what normal pregnant women feel. I've been doing this for 20 years.
Look at this.
If this is so normal, why can't you tell me what's causing it?
I have over and over and over again. But nothing I say satisfies you. And it's all in your head.
It's all in my head.
Yeah, it is.
That's what you're trying to tell me. All of this is in my head.
That's right.
Is it in my head that I gained 15 pounds in a week or I can't breathe when I lie flat? Is the blood coming out of my legs that both you and I see? Is all out of my head too? Is it in my head that my blood pressure is so high it's putting me and my baby at risk? I don't think so, doctor. But I'll tell you what is in my head. That something is very, very wrong. And you are going to use your head to help me figure it out. No, don't tell me to calm down.
Listen, Doc, it has to be something that can be done. She's in a lot of pain. There is blood coming from her
Look,
legs.
I'm almost 9 months pregnant. Is there anything we can do to induce this labor?
We're not inducing your labor. You're not in danger. Your weight gain is under your control.
My blood pressure is 200/98. Are you telling me that that's normal?
That's called white collar blood pressure. She gets nervous when she's here and her blood pressure goes up. That happens all the time. It's very common. When she goes home, her blood pressure goes back down. If you were really in danger, you would have been assigned to bed rest. You'd be in this hospital hooked up to machines 24/7. But you're not, because your numbers are normal. Can I talk to you for a second?
No. You can talk to both of us.
Let me talk to him.
No, he can talk to both of us.
It's no problem. Your wife has to toughen up.
Wait a minute, doctor. It's not like her to complain. Now, she feels she's in danger. Something needs to be done.
Dr. Whitworth, her blood pressure is elevated. Her lab work shows that her blood platelets are low. Have you looked at the swelling in her legs? Have you?
Thank you for your help.
Dr. Whitworth, I'm not trying to be disrespectful, but this woman's in pain.
Yeah, I know, but you're being very disrespectful.
Do you see? She's been in here every day. You're not listening to her. Listen to her. Look at her. She's scared.
She's crybabies. You've seen patients like this.
I'm going to go on record and say that she does not have to toughen up. She's not well, and she needs your help. And I'd like you to take a moment to think about that.
What do you want me to do? How many more tests do you want me to run?
You're a doctor. Be a doctor.
Okay, y'all.
That was
So,
my daughter's exact doctor.
are you kidding
I
me?
promise you, I almost just broke out in tears because that was just the instant replay of what happened 7 years ago when Calliope was coming into the world. That was her exact doc. He said the same exact thing. It's in your head. He,
Wow.
he's fine. He
Wow.
went with it, and I said, "You're not fine," and I kept reporting it back to Thread. This is triggering. This
I'm
is just this
sorry.
is just way too much because that's why I don't want her to have any more kids because she
Mm-hmm.
went through all that and we could have lost her.
Wow. Well, I'm
That is so
sorry.
sad that that is going on around the world.
Yes, it is. It happens. It happens. It happens. I got one more scene. I'm gonna show y'all. Hold on. Just hold on. Hold on. Now remember him telling her it was in her head, right?
Mm-hmm.
Okay, here we go. Hold on. Let me get it set up. All right, there it is, right there. Put it right there. There it is. Hold on, y'all. I'm coming. This daggone ad got to play first. Sorry about that, y'all. The ad got to play. I can't skip through the ad. This is on two. This movie's on Tubi, y'all. Come on, ad. Come on. Lord. But I understand they gotta have sponsors and all like that. Lord, it's the third ad, y'all. I'm sorry. But yes, that's this is really this movie got me when I watched it. It really and this is based on a true story. And at the end, the people that wrote it, they're gonna come up. They're gonna come up. Yeah. That's when I realized it was a true story. I said, wait a minute. This really
Wow.
happened. Yeah. This
Yeah,
really, really
it
happened.
really happened in a lot of people's lives because that's exactly what happened in our life. It's exactly that down to the T.
Yep. This really happened.
And I
And
would
I
love
and
to stay on here, but I gotta go because remember the young man that came by you to give you that invitation? Tonight is
yeah.
that event.
Okay. Okay.
So I gotta go and get prepared for it. But this was an amazing show, and thank you for
Okay.
me to come on your set. I appreciate you.
You are so welcome, love. Thank you for coming up here and sharing.
We got to collab.
Okay.
Okay. Bye bye.
Bye bye. All right, y'all. So, thank you, Janet, for coming up here. This is the next clip I'm gonna show you real quick. Now I'm gonna go on and finish this. Then them be just about finished. Period. So, okay, my computer had went out on me. All right, so I'm gonna show y'all the last clip. Um, but I'm gonna go on and finish this up. Then after be through with the clips, we're gonna be done with the show. So now I told you the complications. You got seizures, you got strokes. This is the complications that can happen to the mother once they get eclampsia. You got seizures, stroke, liver or the kidney damage, or death, or placental eruption. Wow. That's the kind of thing. That's just a few. They had a lot list, but I just got those. A lot of things that's listed for that can happen to the mother. Again, seizures, stroke, liver and or kidney damage, placental abruption, or death. Yes. Now let me tell you what can happen to your baby, to the baby. And again, disclaimer, I am not no doctor, no nurse, nothing of that, no medical profession. Anything that I come on my talk show and talk about is all for educational information purposes, okay? So this is what can happen to a child, the fetal complications. Premature birth, be premature. That's what happened to somebody I know, okay? Low birth weight, yes. Growth restrictions, and sometimes the baby could pass. Yeah. Sometimes you have to make a decision, you or your baby. It comes to that. Sometimes it comes to that. Okay. And it's sad that has to happen. So I went out the rabbit hole a little bit further. So I want to know what is the statistics for the U.S. in 2025. So how about the World Health Organization states in 2025 preeclampsia affects this is according to the World Health Organization. Global has a global prevalence of 2 through 8% of all pregnancies. Maternal deaths, approximately 46,000 a year. Did y'all hear what I just said? 46,000 a year. This is from the World Health Organization for 2025 statistics. Fetal or newborn deaths around 500,000 a year. Wow. Hypertensive disorder of pregnancy. That's called HDP. HDP. 13 to 15% of all pregnancy in the U.S. Wow. 13 to 15%. Wow. And maternal mortality. Hypertensive disorder of pregnancy, particularly preeclampsia, accounts for as high as 14% of maternal mortality. 14%. That high blood pressure, hypertensive disorder of pregnancy. It counts for 14% of maternal mortality. Perinatal deaths, HDP, the hypertensive disorders of pregnancy, results in 10 through 25% of perinatal deaths. Wow. 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 Now, out of all of that, right? Out of all of that, you know we got treatment for it. You get treatment. So let's take a quick look at the treatments. Then I'm going to get to the video. Then we're going to be finished. Now, let me read my comment. Keeping it simple stated. Plus, I encourage my patients to invest in their own health by becoming familiar with the medications that's been provided, to the side effects, as well as their diagnosis. They must be proactive, the part of their care team. Right. You're right about that. There are risk factors in all medications. It is. I reiterate the fact that you must do your own homework if it relates to your health due to due diligence, because usually the patient tells us about themselves and we base everything on what they say. As a skilled clinician, I know how to ask the right questions to find out what's going on, but you have to love what you do in order to take that time. There you go. Take that time, because sometimes it's literally like pulling teeth with an attitude. You better tell it. You better thank you keeping it simple. Thank you. I appreciate that. So when I told y'all about the treatment, you have mild treatment, which is just, they're going to be close, just monitor you really close, and your blood pressure, making sure, checking your urine, protein in your urine levels, and fetal well-being. They're going to be checking that. They're going to put you on bed rest, and they're going to reduce your physical activity. Possible medication to help try to lower that blood pressure. That's mild treatment. Here's the severe treatment. Hospitalization for close monitoring and treatment. Medications to control the blood pressure. And delivery of the baby may be recommended. May be recommended. Okay? Now, when you have eclampsia, this is a life-threatening complication of preeclampsia characterized by seizures, requires immediate delivery of your baby, regardless of the age, regardless of how many months you are. And magnesium sulfate is used to prevent your seizures. That's when you have eclampsia. All right? Now, here's the last part of the clip. Excuse me, y'all.
Now, your baby's breathing normal, but your wife, unfortunately, we've been having some problems. She's on a mechanical respirator.
What happened to my baby, Doc?
We got the tests in just now, and it appears that she's got congenital heart failure and severe preeclampsia.
What the hell is that?
That's a disease that attacks pregnant women. Sometimes which makes them swell. Sometimes it affects their blood pressure. Sometimes it affects their heart. And sometimes it can even be fatal.
It's fatal?
Sometimes.
Didn't they tell you?
What she constantly told you. She constantly told you something was wrong.
Yes, she did.
What was your response? It was in her head.
That's right.
What is it tonight?
Sam,
Is it in her head tonight?
I understand something.
What do I gotta understand, Doc?
Sam, preeclampsia is known as a silent killer. It masks itself inside the normal pregnancy symptoms.
Silent killer.
That's correct.
Silent.
That's right.
It ain't nothing silent about this killer. It's not silent. It was speaking. It was speaking loud and clear, but you wasn't listening. It's your arrogance and your ignorance that wasn't hearing.
First of all, calm down if you want to talk.
Who the hell are you talking to?
I'm talking to you.
You ain't talking to nobody like that. You could have stopped this. You could have prevented it. But what do it lead me tonight?
I just found.
Where did that lead me tonight? You ain't just find out shit.
I just found.
You told me you took every test. Wasn't that your words?
That's right.
Let's talk, Sam. Wasn't that your words?
That's right.
I took your word over my wife's for months. I'm thinking she crazy. What do I got?
Your wife.
No, what do I got, Doc?
Your-
I have shit.
Your wife. This is serious stuff, and I'm gonna need his help.
You go fix this.
I'm gonna fix it. And
Get out of my face, Doc.
I need his.
Get out of my face, Doc.
Okay.
Hey, Omega, thank you for coming in. Happy Friday to you too, my love.
Your wife's in critical condition. Can't breathe on her own.
It's a nightmare. She has what's called preeclampsia.
Yeah, I heard that.
As a result, her hypertension is uncontrollable.
So why didn't any of you see this happening?
Well, there were a few symptoms that were evident, but with a disease like this, you have to understand that it attacks from within, and it's not very easily diagnosed.
Is that right? Symptoms. Swelling, high blood pressure, headaches, stomach aches, not being able to lie flat.
Shortness of breath and rapid weight gain.
And it was all in her head, right?
Mr. Logan, please, just let us explain. Because we were unable to detect it, It developed into what's called peripartum cardiomyopathy.
What's that?
It means her heart has been damaged. It's failing.
The lungs and her kidneys are also extremely weak.
It's the machines that's keeping her alive.
We have to inform you that 80% of patients don't survive.
How could you miss this? Why didn't you see this happening? How could you miss this, Dr. Whitworth?
Mr. Logan, we promise we are going to do our best.
Is that right? Your best. And I guess this is your best. Mr. Bookwriter, this is your best?
Saying we'll do everything.
Let me get to it.
There's absolutely no way in this planet, on this world, that I would ever sign off on my wife's life.
We
And
understand,
they
Mr.
want him to
Logan,
pull the plug
but
on.
the x-rays
Why
confirm our worst fear. She has cardiomegaly and congestive heart failure. Her vital organs are failing.
Watch this.
We get out of here and get your hair done.
This really
Go on
happened.
vacation.
To a couple.
You worked hard, you deserve it.
We've seen 250-pound men who didn't come out of a comatose state as weak as her. 80% of patients don't survive, and she's more severe than most.
Hey, let me read you something. What you want to know about? Hey, let's remodel the kitchen when you come. We can do, I don't know, granite countertops? No? What about new drapery? Whatever you want, we'll do. Gotta come home with me though, baby.
Y'all watch this. Think y'all could
Say there's a 20% chance she'll make it.
Yes, but...
Well, that's all she needs.
Excuse me?
20% is all she needs. See, y'all don't know my wife. And you definitely don't know my God.
Come on now.
No, y'all don't know my God. Look here. 20% is all my wife needs. So y'all see me tomorrow. And the day after that. And the day after. Y'all see me each and every day, me and my family. Until my wife walks out of here with me.
Right.
With me.
Right.
Have a good day.
Y'all see that?
I just hope she doesn't die.
All she needs was 20% and God.
Hey.
20% and God. Yeah. Yeah.
Read the song. I need some help just to make it through the struggle. Trying my
This is
best
a very good
to stay
movie,
out
y'all.
of trouble.
So y'all get a chance.
I see the light at the end of the
I
tunnel.
think they're spinning now.
You gon' make it. You will make it. Remember, I sung that to you the first night we met. Night you had the red shirt on, crazy flower on his shoulder.
They wanted him to give up on his wife.
But I
But
hated
like
that
you
shirt.
said, all she needs is
Crazy shirt.
10% in God. Y'all don't know my God.
But I always loved you.
This really happened.
I gotta apologize.
This really happened,
I should have
y'all.
believed you.
The ending of this movie
You believed
blew
in me.
me
I
away.
don't care how long it takes.
It's a series, it's a twist in this.
I'm not going nowhere.
It's a twist in this, my God.
Roxy,
I
doctor,
think
no
he
nobody.
hollered when I saw the
Let me
end
stop
and watched
believing.
him this movie.
Don't come back to me. I love you like
So
that.
it's real. Preeclampsia is no joke. It's no joke. It's killing a lot of women. And a lot of doctors is not even showing no concern for it. She tried to tell you, but they tried to do that.
I can make it. I'm gonna make it.
1 year later.
Yeah. It's funny how things can take your breath away. Something I didn't know existed almost ruined my life. A disease called Preeclampsia. I wish I can go back in time. Now
Hi, this is Angela Bergen-Logan. Pregnancy-related complications affect 1/3 of all women. For more information, go to ladiesliveandlearn.com.
The people that really produced this movie. Excellent movie. I recommend y'all go watch it from the beginning. Because I'm telling you, it had me, like I said, in a serious chokehold. It really did. It really did. But the bottom line is this. I'm getting ready to end this show, this segment. Thank you to those that came out to watch this. Let me see. Do I got anybody in here? Is anybody else in here? Hold on. Let me get back to my stuff over here. There we go. Is anybody in here? Well, nope, not no more. So anyway, what I'm going to do is the people that was in here, I'm gonna put your name on a spinning wheel, and doing my show tomorrow. I got one tomorrow. Y'all come back out again, cause this one's supposed to have been yesterday, but something came up, so that's why I did today. But I got my show on polycystic ovary syndrome tomorrow. Polycystic ovary syndrome tomorrow, 5:30. Okay. I'm still gonna be giving away stuff, but what I'm gonna do, the people that I see in here now, not the ones that's watching the replay, the ones that came in here in my live today, live. I'm gonna put your name on the spinning wheel. So that's Omega Blue. She came in. That everybody gone now, but it's okay. Omega Blue. Keep it simple. Keeping it simple. Chilling with Teddy Ray. Hey, I didn't see you when you came in. I'm sorry. Chill with Teddy Ray. Teddy Ray. 34 minutes. And Janet Brown. Okay, so it's Janet. Keeping it simple. Chill with Teddy Ray. And Omega Blue. I'm gonna put y'all name on the spinning wheel. Do a spinning wheel. So I'm gonna do all that tomorrow on my other show at 5:30. I'm giving away some stuff, okay? Cause no, you know what? No, because I got to take time to put it on the spinning wheel now. No, I'm not gonna do that. I just do it tomorrow. Or I might come back tonight real quick and go and do the spinning, have it already on the spinning wheel, and then go on and get it done. But either way, if I don't come back sometime tonight while I'm in my house, it'll be tomorrow on my 5:30 show. Talking about polycystic ovary syndrome. But the bottom line, my queens, if you are expecting a baby, or you got somebody that you know they're expecting a baby, please make sure that you let them know, or that person let them know how things is changing. And if your doctor is not satisfying you, you have a right to request another one. You do. So with that being said, thank you to all y'all that came out. Thank y'all for the comments. I am getting ready to go. Y'all finish. Have a good weekend. I am going to go in the house now, okay? But I will see y'all tomorrow, 5:30 p.m. Eastern Standard Time, providing don't nothing happen. You know how things can happen. And I'm going to do the spinning wheel and all that for the gifts today, for the ones that's in here now, not the one that's going to be watching the replay. All right? Bye-bye. I love y'all. Thank y'all so much. I so appreciate y'all. I really do. And y'all know what? Y'all have a good day.